Good day. Greetings from South Africa, and thank you to our host, Professor Hari Krishnani from Malaysia, and also Prof. Abbas for hosting this International Awareness Day as part of Diabetic Awareness. So today I will be presenting a lecture on the empowering the lives in South Africa, a nurse's role in the diabetes awareness and self-management of education. This is also exploring the pivotal role of nurses in enhancing diabetes awareness and self-management, especially in the underserved communities. This is my qualifications, and I work as a wound care specialist at the 2 Military Hospital, and I'm also, just as a disclosure, the Vice President of TFIT International. So I'm based in Cape Town, South Africa, and also the aim of my presentation will be to raise awareness and empowering the communities through the education, focusing on a statistical overview of diabetes in Africa and the impact on the healthcare system. So to understand the current diabetes in South Africa, it's important to know that there is 4.6 million adults in South Africa living with diabetes, with a staggering effect or 70% remaining undiagnosed, highlighting the urgent need for awareness and screening initiatives. This is the leading cause of death and also emphasizing the critical public health challenges it presents to, as reported by the statistics in 2025. So key factors contributing the rise of diabetes include the urbanization, the unhealthy dietary habits, the lack of physical activity, social economic disparities with a disappropriate effect of vulnerable populations. Nurses as the pioneers in diabetes education. I think it is important to start with at home, like I always say. So this is a product fair that I'm hosting as pressure injury and also diabetes foot ulcer prevention day later this month. So nurses are crucial in the diabetes education and serving as the initial point of contact in the healthcare. We are facing the patients and always seeing them on the first entry. So we deliver the essential self-management support, which encompasses blood glucose monitoring, medical adherence, and also the lifestyle coaching. Specialized training programs from the CDE Academy in Johannesburg and the Intercare e-learning enhances the nurses' capabilities and ensuring that they are well equipped to address the complex needs of patients effectively. So as a wound care association, we also believe that prevention is better than cure. So we went into a public small for diabetic education and free screening, and we were actually overwhelmed with the amount of not only clients in the mall, but also the staff who came for free screening. And it's important just to keep in mind that if you do a project like this, you need to have a backup system and the referring doctors. So we had one of the doctors in the mall that was actually available for free referral and treating of abnormalities until the patient could be referred to their own healthcare workers. So we also do the same in the hospital setting. So this project was done in 2023, and we, as mentioned, we will have hosted later in this month again, where we move into the public areas and the foyer of the hospital, so that you can screen not only patients coming in, but also visitors and other staff. And the role of the organizations and the Diabetes Alliance are instrumental in fostering the community wellness initiatives. They support the creation and implementation of peer education programs and outreach efforts that raise the awareness about diabetes and promote healthier lifestyles within the communities. These organizations aim to engage the public in proactive health management. So this picture on the left is a typical setting of some of our rural areas and the members coming together around a fire. So it's important also for education and how to prevent injuries. As we all know, when you're getting cold, you tend to crawl up to the fire, and this is how the diabetic patients actually have some burns because of the neuropathy, and they're not able to feel the heat of the fire. And then the role of the nurses in the clinics. Nurses play a crucial role in these initiatives by empowering with community health workers to provide cultural sensitive education, and they facilitate the support groups that offer the ongoing patient engagement and ensuring that individuals receive continuous encouragement and the resource needed for the effective diabetes management. Local clinics serve as the hubs for these activities, enhancing accessibility and support. So I believe in having some fun sometimes. So part of the Diabetic Awareness Day, we had a amazing race. And then the staff members had to visit different clinics and treating areas for diabetics. This is included the Wound Care Center, the Department of Family Medicine, the Diabetic Clinic, and also our renal unit where patients receive dialysis. And this is also just something, if you have fun by learning, I'm sure that you will remember it for future. And then you can also teach this to your friends in your community, in the public. So the challenges in the current South African context is limited access to healthcare, and access to healthcare remains is a crucial issue in the rural regions where many individuals with diabetes struggle to receive the timely medical attention and proper management due to the distance and lack of facilities. So this picture was taken on a road to Sutherland for members who know where it is. It's one of the coldest areas that we have in South Africa, but it's also a very popular tourist destination. But as you can see, it's the road is not the best, and also remote. So most of the members living in any of the remote cities or smaller urban areas, they are not able just to get into the car. And there's also a lack of public transport. So this means that they're not able to get to healthcare facilities and get medication or even advice timely. And then also the knowledge of gap among nurses. Nurses face significant knowledge gaps in diabetes nutrition and self-management strategies, impacting the quality of the patient care and education. As you know, that the young generation don't learn the same way like the older generation did a lot, and also they have individual needs on nutrition. So it's important to target both of these themes, and also for understanding the patient, the elderly patient, and also to know about the resource for the nursing staff. So nurse burnout and resource constraints is prevalent among the nurses working in the public health facility due to the high workloads and insufficient resources. This affects the ability to provide optimal care for diabetic patients and lead to the cycle of decreased healthcare quality. So this is artificial generated picture that was I generated a while ago on one of the days that I had no food at work. You didn't have time to eat, and because you're running around to get some products or the appropriate product for care. So it's just, I think most of us working in a public health facility are familiar with this. And then also the transformative impact of nurse-led initiatives. We have a local project that SA that has significantly advanced the diabetic care by training over 4,000 healthcare professionals that included nurses and who is now equipped to lead community support efforts. And these nurses are actively conducting screening campaigns, facilitating educational workshops, and establishing peer mentoring programs, ultimately enhancing the diabetes management and awareness across South Africa. And the actions for diabetes management includes the strategies to enhance the nurse roles, In 2023, there was a project to prioritize the investment of nurse training and ongoing professional development to enhance the skills in diabetes management. In 2024, there was an integrated comprehensive diabetes education into the national health policy to standardize care practices across the country. And in 2025, empowering the nurses to lead the community-based interventions that advocate for the improved diabetes care and self-management among patients. And then key aspects, even as a wound care provider or wound care specialist, you also need to train some of the other patients coming in the reporting in the hospital on prevention of complications, as this education is crucial to prevent the severe complications such as ulcers and also infections. And proper indication helps the patients recognize early warning signs and to take the preventative measures and significantly to reduce the risk of diabetes-related amputations. So all my patients know that they must take one step at a time. If they receive or see that there's any wound or any damage on the foot after a daily evaluation, they need to report early to the clinic because I teach them that the sooner you can get there, the better the results can be of treating that and preventing amputations. So they are conducting regular foot examinations, as mentioned, to identify the issues early, and also to proactive approach ensures that patients receive timely interventions and comprehensive education on maintaining the foot health as part of the diabetes management. And it's also a good idea to just to teach the circle of care, either the husband or the wife. You tell them just to look at your husband's feet and maybe just screen because you tend to miss and don't do your own foot examination. So it's important for somebody to have a look if you're lucky enough to have a partner. And then we also treat them on the importance of proper footwear, about the footwear that can prevent foot injuries and also the complications. And nurses provide the guidance on selecting appropriate shoes, which is integral to the overall diabetes care strategies. Sorry. So we teach them not to walk barefoot in hot sand or on the beach, not to wear the flip-flops and the sandals, but rather use closed shoes with cotton socks to prevent any injuries. And then the following references, which is crucial in the insight and data on diabetes in South Africa, and focusing on the healthcare standards, statistic and management of protocols, and addressing for the growing health concerns. So this is the reference list. I would like to thank you for your attention and for providing me the opportunity to share something unique and not necessarily only wound care and the management of the diabetic foot, but rather managing your patient as a whole as a diabetic, and also to screen them and to share all the knowledge that you read and gain from reading up in the books and from following up on lectures. So thank you for your time. I'm looking forward to see what the rest of our members are sharing with us on this Diabetic Prevention Day. Take care.